Hello. We're going to talk about urinary catheterizations, care of, the types, and the complications. 3 different types we're going to go over: straight catheters, Foley catheters, and suprapubic. A straight catheter is a catheter that's inserted into the bladder to drain urine intermittently throughout the day. Foley catheter is a catheter which is inserted into the bladder to drain urine continuously. Suprapubic tube is a catheter inserted surgically into the bladder through the abdominal wall above the symphysis pubis. This catheter drains urine continuously. This is a picture of a straight cath. You see the drainage port here, and it just has its simple catheter with the little hole. These are 4 different types of Foley catheters. The top one is a one-way catheter, which is also known as a straight catheter. B is a 2-way catheter, meaning it has a balloon port and a drainage port. C is another 2-way catheter called a coude, usually used for prostate enlargement because it has this curved tip. And D is a 3-way catheter for irrigation. You have a balloon port, a drainage port, and an irrigation port. This here is a picture of a suprapubic with a dressing on it. As far as straight catheterizations, the purpose is to relieve urinary retention, allows for measurement of residual urine in the bladder. You can obtain a sterile urine specimen from this, and you can empty the bladder before or during surgery and before certain diagnostic examinations. Foley catheter purpose could be for acute and complete inability to void, need for decompression of the bladder, to monitor intake and output, temporary relief of bladder outlet obstruction, secondary to a potential enlarged prostate gland, a stricture of the urethra, obstructing pelvic organ prolapse, if intermittent catheterization has failed or it's not feasible, or both, after a urological or gynecological surgical procedure, irreversible medical conditions are present, presence of pressure ulcers that are not healing because of continual urinary incontinence, and when a caregiver is available to provide incontinence care. Suprapubic tube purpose: the urethra is damaged or injured. There may be weak pelvic floor muscles. After surgeries that involve the bladder, uterus, prostate, or nearby organs. Also, if the person is sexually active and needs a catheter for a longer period of time, they would choose a suprapubic. It's used for long-term use. It's comfortable and easier to change than a urethral catheter. Also can be used if there's a bladder blockage that cannot be corrected with surgery or other treatments. Incontinence that is causing skin rashes and irritation or making them worse, and they are used also in terminally ill or severely impaired patients. The technique for a straight catheterization is you want to gather all your supplies, which include a catheterization kit if you're doing sterile technique. If you're using clean technique, soap and water, washcloth or gauze, gloves, water-soluble lubricant, appropriate size catheter, a urinal, a paper chuck or a towel to place on the bed for protection. You're going to wash your hands and put your gloves on, prepare the catheter, apply the lubricant to the tip of the catheter. Do not touch the catheter. Have patient lay in comfortable position. Supine would be preferable. Females, you want to bend their knees and flex their hips, separate the labia and expose the urethral opening. Males, you want to lift the penis and retract the foreskin if non-circumcised. Do not force the skin back, especially in infants. Females, if you're using sterile technique, you're going to use the swabs, clean the labial folds and urethral opening. Move the swab from the urethral opening down towards the opening, down towards the rectum. Discard the swab after each urethral stroke. Clean technique, you'd use a clean washcloth with soap and water. Again, separate the labia, wash the urethral opening thoroughly with soap and rinse clean with water. In males, if you're doing sterile technique, you're going to use the swabs, clean the urethral opening using a circular motion from the urethral opening to the base of the penis. If you're using clean technique, use a clean washcloth with soap and water, clean the urethral opening using a circular motion from the urethral opening to the base of the penis. Lubricate the appropriate size catheter. Always check your orders. Females, you want to insert the catheter into the urethral opening upward at approximately a 30-degree angle until urine begins to flow. Males, you're going to hold the penis with slight upward tension and perpendicular. Insert the catheter. When first sphincter is reached, gently bring penis down to face patient's toes. Urine should begin to flow. If there is no urine, increase traction on the penis and apply gentle pressure on the catheter. Ask the patient to take a deep breath, to cough, to bear down. Gently rotate the catheter. Never force a catheter. Once the urine begins to flow, advance catheter approximately 1 inch. Place the other end into a urinal or a container. Allow all urine to drain. After the urine flow stops, remove the catheter slowly. Measure drainage if there is an order to record output. Document the output, clear versus cloudy, the color, the odor, if there's mucus, sediment, or blood, and how the patient tolerated the procedure. Foley catheterization, you're going to follow the same steps for straight catheterization techniques up until urine begins to flow. Once the urine begins to flow, inflate the balloon slowly using sterile water to volume ordered. Withdraw the catheter slightly until resistance is felt and attach the drainage system. Secure the catheter to the thigh with either a catheter securement device or tape. Suprapubic tubes. Check your orders, gather your supplies, sterile catheterization kit, normal saline, a 10 milliliter syringe, a blunt needle, incontinent pad, sterile catheter, appropriate size and 1 size smaller, 2 pairs of sterile gloves, sterile water, irrigation solution if ordered, 60 milliliter catheter tip for irrigation, drainage bag, sterile gauze dressing, tape, and a securement device. Wash your hands, put your gloves on, position the patient in supine position and place incontinent pad under patient. Prepare sterile field close to patient and add that catheter to the sterile field. Apply gloves, apply sterile drape over SP tube area, wet gauze with a normal saline and clean the site. Always go from the stoma outward. Inspect the catheter for leaks, lubricate the tip of the catheter. Deflate balloon and remove the existing catheter. Change into new sterile gloves. Hold the catheter at a 90-degree angle, gently and slowly insert catheter down the cystostomy tract. Never force the catheter. Inflate the balloon with the ordered amount of sterile water. If resistance is felt, the catheter may need to be inserted further or pulled back slightly. If there is an order for irrigation, irrigate it with the prescribed solution. Attach urine drainage bag, ensuring it remains sterile, and bag remains below level of catheter. Apply dressing to cystostomy site. Secure device to abdomen. Document color and characteristics of urine, the tolerance of the procedure, size and type of catheter, the balloon volume, and measured length of external catheter. As far as care of a Foley catheter, daily care should always be done, and PRN. Clean with warm, soapy water daily around the catheter insertion site. Uncircumcised boys should have the foreskin gently eased down over the catheter after cleaning. Clean the drainage bag every day after removing it from the catheter. Troubleshooting: if the catheter is not draining, blocked, or the patient is oliguric, check the catheter, the tubing is not kinked. Check that the catheter is still secured to the patient leg and it hasn't migrated out of the bladder. And you want to assess the patient's hydration status to ensure they're not dehydrated. Daily care of a suprapubic catheter: again, you're going to cleanse the area around the catheter with soap and water once daily and as needed. Apply gauze. You're going to clean the bag every day per orders. Troubleshooting: not draining, blocked, or patient is oliguric. Check to see if the urine tubing is twisted or bent, or if the patient is lying on the catheter or tubing. Make sure the urine bag and tubing are located below the level of your patient's waist. Move them to a different position. Irrigate the catheter per order. And again, assess their hydration status to make sure they're not dehydrated. Complications that can occur with a urinary catheter: urethral injury may occur from trauma, sustained during insertion, or balloon inflation in an incorrect position. They can have a hemorrhage, urethral strictures following damage to the urethra. Infection, you want to monitor and report signs of infection including fever, offensive smelling urine, unexplained blood, or cloudy urine. Also, you can have psychological trauma and paraphimosis due to failure to return foreskin to normal position following catheter insertion. When removing a catheter, you want to wash your hands and don gloves, deflate the balloon completely, gently withdraw catheter with rotation movements if necessary. Remember, the balloon won't deflate to its total initial flat state, and the balloon portion of the catheter will remain larger than the catheter itself. If resistance is felt and the catheter cannot be easily removed, do not force. Leave catheter in situ and consult medical team. Once removed, inspect catheter for intactness. Report if it's not intact. Always document the procedure and how the patient tolerated. Over to the right, it shows the balloon being inflated, retaining a little bubble, and then on the top, it's a completely deflated balloon. You want to pull out as much as you can to make sure that it's almost flat with the catheter. That's it for urinary catheters. Thank you.